Well, glioblastoma is the most common and severe form of brain cancer. It's a cancer that develops in the tissue that surrounds the neurons in the brain. And it tends to be very aggressive and grows very rapidly. And unfortunately, even with today's best standard of care, most patients don't live much beyond 18 months from their diagnosis. The only drugs that have been successful in shrinking the tumor and extending life to date are called alkylating agents. And the challenge is that the drugs that are out there today generally work through the same mechanism. And so patients who become resistant to one are resistant to the next. And unfortunately, most patients do become resistant or don't respond to today's chemotherapies. In fact, at the American Society of Clinical Oncology, ASCO, in 2011, there was some very important research that was presented to the audience. This research really brought home the importance of the resistance mechanisms to today's chemotherapies in the treatment of glioblastoma, and really the reasons why people fail those chemotherapies today and the reason that this cancer is so deadly. And the panel was asked, if you had a drug, a chemotherapy that was able to get into the brain and was not subject to those same resistance mechanisms, would you use that in the treatment of glioblastoma? And this panel of experts across the board unanimously said, absolutely, we wish we had something like that. And we were sitting in the audience and the light bulb goes off and says, wait a minute, that's what we have. We have the tool that these clinicians need to help their patients.